Crisis of our generation. How we respond as individuals, governments, and nations will likely reshape the world as we know it. We've seen the impact of the coronavirus pandemic and what it's had on our healthcare systems, economies, even politics. But what about our culture and psyches? Well, as we try to get ahead of the COVID-19 pandemic, what is the social and mental health cost? That's our discussion tonight. Watch.
Even the people like
Dr. Susan Gitau is a counseling and trauma psychologist. She's also a lecturer and chair of the Department of Counseling Psychology at Africa Nazarene University. She shares on the importance of psychosocial support in the midst of containing a pandemic.
For us, it has worked out, especially introverts.
Cornell Ngare is a freelancer and former journalist who talks about the effects of COVID-19 pandemic on individuals predisposed to depression and anxiety. Having previously been diagnosed with the same, he shares his coping mechanisms. So a lot has been happening over the last few weeks. I think this is probably the most followed story globally, and for obvious reasons. And there's a lot that comes with the kind of stories and reporting and pictures that we see coming through the airwaves. Dr. Gitau, as you're observing, and this is not even as a doctor, just as a human being, as a Kenyan citizen, we're seeing the limiting of social gatherings, of movement, and we've seen around the world far more stricter measures being taken. And it can cause a bit of anxiety and worry of people wondering, what next? What will happen? From where you sit, what is a cause for concern, in terms of what you're seeing happening around us?
We are having people behaving abnormally. There are people we can say maybe initially they had their own mental health conditions, like you suffer from panic attacks. We have people who have already been diagnosed with panic attack. We have people who have depression, who have always had negative thoughts. So you can imagine right now those negative thoughts are escalated. We have people who probably had gone through something traumatic. And so one of the signs and symptoms of trauma is hyperarousal, which manifests like high-level anxiety. So where are they right now? We have some people who had common cold. And now they can't even get sick because if you get more anxious, that is basically stress. So your immunity goes down further. In fact, right now, today, I had a student from Africa Nazarene University who was telling me, I don't even want to go to my practicum site because I'm really coughing, And she's there saying, I have just decided to quarantine myself. But I asked her, what else are you thinking about this situation? Yeah. So we also have parents who are saying, we don't even know where these children of ours came from. We don't know, like the ones who used matatus, what they brought. So you can imagine you're going home, you're a student from boarding school, and at home, your siblings or your parents are already saying, sanitize yourself. It's just a whole new thing because there are some boarding schools that are never allowed to watch TV. They don't get a lot of updates on newspapers. So they're coming home with all this confusion. Others were preparing for exams. And all of a sudden you have a mind right now that has gotten a block. So you're actually having people also processing so much information. Today you get this post, this is the way to fight coronavirus. Yeah. Tomorrow you get another one, and you're like, what do I take?
And Cornell, and Dr. is right, we're being inundated with information. If it's not television, it's our mobile phones, on WhatsApp, on Facebook. There's so much going on, and you shared a very interesting post the other day about the unseen impact, if you will, of COVID-19 and containing it as well, and what it would mean moving forward. People who are in the event space are really suffering because of cancelled conferences and whatnot. People who are casual laborers as well. If a construction site has been shut down, what are you to do in terms of sustaining yourself moving forward? So there's a lot of anxiety surrounded by very valid emotions. So what kind of prompted you to write that?
I think first it's just because that's the space I currently exist in. I work as a creative, but also as a freelancer. And one of the challenges, you have things planned, maybe for the next few months. This is coming up. It could be a media event, and you planned for clients, and then now you see everything is being shut down, and the first thing you think of is it's not even about the virus. It's about like your source of income. And the ironic bit of it is that many people who are freelancers tend to be the creatives, and the creatives tend to be the ones most impacted by mental health issues. It's like they're the most delicate. So it's just like a flood of several things that you can't control, because your job is hard to control already. Since you're not in regular employment, you don't have a regular source of income. All depends on how you shape the circumstances around you. So what goes up immediately is the anxiety. And even as I was writing that post, I was looking, like the friends I relate to, especially on social media, I'm seeing their posts. I'm seeing things being cancelled. I'm seeing events being put on hold. They're just being told, okay, put this on hold for now. Don't show up on this day. We'll communicate further. And that wasn't in the contract. Something like that, it's unforeseen. So you can't even push back and say, so am I getting paid anything? And that has just been a source of stress for many. And so I just started feeling this burden that, we're talking about washing hands. We're talking about the particular, like focusing specifically on the virus and how to prevent that. But there's this other infection and there's other pandemic that's growing and nobody's talking about. And this is the pandemic of fear. And I just felt I had needed to talk about that and address that.
We may not know what's going to happen a week or two or a month from now. We never saw this when 2020 began. I know we had such bright hopes for the new year. 2019 was such a tough year for many people. And here we are grappling with a pandemic. No one saw this coming. And so my next question would be, how do you, and it's tough, but how do you kind of put in measures to prepare for that eventuality of the unknown, of something like this happening? Because this is not going to be the first that we're dealing with, just with how the world is progressing and moving forward. But how do you kind of put in those measures to kind of buffer against something like this?
Psychologically, when you're calm, it's like you're sort of able to think through your problems and you can get a solution. But right now, everybody is in panic mode. So who is there telling the common mwananchi to Leah, calm down? Who is there? Who is doing it? I would also encourage that the mental health and psychosocial support in this nation, I know they talk of we have it, but it's not structured. I think we really need to scale it up. And when I say scaling it up, is moving from the specialists who speak from the offices to having mental health practitioners on the ground, the community counselors, because people don't need to panic. Because at the end of the day, I believe it will go, but how will it go? How much impact will it have left? Like now, government offices, no operations until when?
Right, exactly. And I guess this whole, and it raises the anxiety, that feeling of, okay, how long will this actually last? Speaking of which, because they're talking about social distance, self-quarantine. I mean, these are going to be new vocabulary words for us moving forward. But when you're thinking about people who are already grappling with feelings of isolation, depression, anxiety, and then you're being told to stay away from people, what is the impact of something like that?
It's interesting you asked that. Like, as Dr. was talking, I was thinking about how easy, especially it's been to say, don't panic, be calm. And what hit me was, even as we're insisting so much on the social isolation and social distancing, the things that we are totally clueless about are social consciousness, social responsibility, and just being aware and socially aware of, because if you're telling someone not to panic, whose life has depended on, like they used to survive on maybe the community or the society that they live in. That's how they get by. That's why they're not drinking, because they could do A, B, C, and D. The people who, it may not have been the best crutch, but they would go and bury themselves in work. Now they're being told, work from home. And I'm like, no one has any idea, okay, I have distanced myself. What do I do with myself? Like, I don't know how to be with me. Like, I'm not used to that. And it's making me go crazy. So for me, that has been, personally, it has also been a big challenge, because even though, like, having struggled with depression and anxiety, it's easy to say that for us it has worked out, as especially introverts. We're like, okay, we're already used to this, but we tend to do that because we have chosen it for ourselves. We think it's the best way, and no one else is doing it, so we're managing the circumstances around us. But now when everyone else is doing it, the one time you actually want to get out, the one time you want to relate, you want to cope, you want to talk to someone, suddenly it's not working out. And so that uncertainty, and you know, this particular pandemic is it's not like any other crisis, like an accident or an explosion that is happening in one physical location, where you can just say, if I avoid that town or avoid that area. It's uncertain in terms of when it will end. Even if they discover a cure tomorrow, there's that reverberation, so you don't know when it will end. And then it can happen anywhere and to anyone. So any control, any sort of control you thought you had, there's none. And so my appeal would be, like, even as we're telling people to isolate and keep like the social distance, we need to ask ourselves seriously about what does it mean to be responsible for other people. Like one of the reasons, and this keeps being forgotten a lot, one of the reasons we're doing all these things is not like washing our hands, social distancing, is not so that we cannot get the virus. There is the systemic issue of not overwhelming our healthcare system, and that is a social responsibility thing. The lack of social responsibility is what is making people rush to the supermarket. They don't care about anyone else. I'm like, I'm going to stock up for myself.
You know, and even thinking about, will life ever go back to what it was? Because we're now employing new social behaviors. We were just talking with some other people earlier that we can't shake hands. It's so un-African, you know, that you can't have that physical interaction with someone. But will this inform how we interact and socialize moving forward, or do you think this is just a temporary thing? I mean, what do you make of it?
Well, there's so many questions, so many questions. But how do we address this? How do we make sure we come to normalcy? Right. When people are traumatized, we always think it's like you're moving and then there's a trench and you get inside. Believe you me, when you get out, you can never be at the same level. So there's a lot that is gonna change, and I guess the best thing is to track the changes. If we can change some things for the better, like basic hygiene, hand washing, you know, we have taken these hand washing campaigns for granted.
It's true.
Yeah,
it's true.
Now we might take that seriously. What about the body contact?
Yeah.
Yeah, because I think we hug everybody. We also shake hands, everyone. You know, we are gonna change in terms of even the way we keep our facilities.
Absolutely. Yeah, and I think as we wrap up, Cornell, I'd like to hear from you, because you've been very open about your experience with depression and anxiety, and that has been a lived experience for you. If you were to talk to someone who's in that space now, given the circumstances, what tips would you give in terms of self-care?
Yeah.
What should someone be doing now to ensure that they are okay first?
I'm not taking any news from social media. I have done like subscription, maybe alerts for reputable news breaking sites where I know they can't just break anything. Exactly. But like going and looking at the timeline and looking at what people are talking about, like I have deliberately avoided that. I'm limiting it. It's so weird because we rarely watch news on TV, but right now many people are watching TV.
Exactly, they are. Yeah.
And also incidentally, because many of us are at home.
Right.
And a lot of us are on social media, so social media is overwhelming. So people, if I really want to get something concrete, let me just go to the TV, because I know they've done the homework. They don't have time to just talk about all these other things. So be very careful and conscious about where you're getting your source of news. The other one is just the practice of, because this should have begun before, even when you're already in the crisis, like taking care of yourself, being aware of your mental health, the things that you've been using as crutches. So this can be a good time to evaluate how you've been living. You know, one of the things that this situation has done is clarified our values, as you've said. You know, even the people like in the religious circles, you know, people will talk about everything. I don't know, this prophet is going to heal people. Now people are realizing, I need to be serious about the people I'm listening to.
Right.
All these things that I'm seeing on TV, people are being reckless with what they're saying. So it has really clarified the things that we think make sense of our society. So, and that's the thing I would say, evaluate the things you believe in. It's a good time to evaluate where you find your hope. As she talked about hopelessness. So your source of hope right now, if it was drinking, clubs are closed. If it was those social clubs, all these things have been forbidden. Now you really have to find out what is the thing that keeps you going when everything else is falling apart.
If nothing else, this time, this isolation period, beyond keeping yourself safe, is a time for introspection and reflection as well, to reevaluate, to recharge, but also to recalibrate some things. If you went off course correct, this is the time to do it. You don't know when you'll have 30 days again to be able to have this time to yourself. Keep the conversation going on social media, #CitizenWeekend. Thank you for watching.